Good morning. Good to see you as always.
Good morning. Thank you.
And you mentioned the weather is great. That is de-stressing me, which is good for my blood pressure.
Makes
I
me
would
feel
hope.
good too. Yeah,
I would hope
right.
so. So, is that what we're basically talking about today? Hypertension, which is high blood pressure.
High blood pressure, and a lot of people have it, and a lot of people, it's the easiest thing for most providers to treat is hypertension. We usually start with.
By the way, is dangerous.
It can be dangerous, and most people don't realize they have high blood pressure. That's why it's a silent killer. So we all need to be checked to make sure our blood pressure isn't too high. But just one blood pressure in the doctor's office that's elevated doesn't mean you have high blood pressure. Many people have white coat syndrome, and there's nothing you can do about that.
I like that name.
Yeah, so I don't even wear a white coat, and it's still high. But everyone should probably just be aware of their blood pressure, check it periodically. I think it's really good to have a blood pressure monitor that you can use at home every now and then to see where it tends to run. But when it becomes elevated, then we need to do something about it. And elevated blood pressure, the guidelines have changed back and forth, and now we've got pretty a low threshold to treat it, which I'm not sure I really agree with that. The normal blood pressure is 120 or over 80 or less. That's considered ideal. Between 120 to 140 as the systolic blood pressure, and 80 to 90 is called prehypertension, and they ideally would probably like us to treat that. And that's based on mortality data. We know that when those blood pressures in those ranges are seen in most of the population, their risk of heart disease and stroke goes up. Mm-hmm. But it really starts to ramp up when the blood pressure is greater than 140 over 90. And so those are the ones that most of us would agree have to be treated. Now, when you're in your 70s and 80s, sometimes we're a little bit more lenient with blood pressures in the 140s. And I'm not sure if that's right or not, but it's really difficult sometimes as you get older to be treating blood pressures so aggressively that now your blood pressure's 115 over 70, but you're lightheaded and dizzy and it's too low, and you're not feeling good, and you're taking 5 blood pressure medications with low potassium. And so you have to use common sense. But the point is that we need to make sure we control our blood pressure, and it will tend to go up with most of us with age. The most important thing to realize is a small percentage of people with high blood pressure have elevated blood pressure because they have kidney disease or kidney problems. But that's a minority. Mm-hmm. I'd say 95% of the population, it develops because of lifestyle changes, lifestyle choices. And that's really what I wanted to talk about, because if we understand those lifestyle choices, we can do something to impact them.
Hypertension untreated can lead to stroke.
Right? Which is devastating, obviously. I mean, that's one of the worst things that could happen to any of us, to be fully functional one day and the next not able to use our arm or our leg or to walk or talk or any of those kind of things. The worst stroke is a stroke called locked-in syndrome, where the only thing you can move is your eyes. Mm-hmm. You can't talk, you can't move. You're really just locked in a body that is paralyzed, and I've seen that. That's just a devastating way to live.
Yeah.
And so we want to do all we can to prevent those kind of issues. And heart disease is another common problem, and uncontrolled hypertension can lead to kidney problems, kidney disease, and dialysis. So there's consequences to not controlling it, and we really don't want to be ignorant of our blood pressure.
But again, there are lifestyle choices to make, which if it is high, can it bring it down and make
absolutely.
It right?
Yes, okay. Absolutely. And in the Fit for Life class, I have a table in the workbook that says with healthy lifestyle, we can lower our blood pressure anywhere from the systolic blood pressure up to 50 points. And that's significant. So let's say your blood pressure's 170 over 100. Well, that means if you use these lifestyle interventions, you could possibly get it down to the normal range. Mm-hmm. And it really comes down to controlling inflammation. We say hypertension. Essential hypertension is the term that we use in medicine. And basically that means your blood pressure is high and we don't know why. Well, I think we know why. It's an inflammatory problem. It's age-related. So we'll say lose weight. Why do you have to lose weight? Well, when you have a big gut or you have excess weight, you have more inflammation in your body, and that inflammation causes the blood vessels to not be able to dilate. When you exercise, you're forcing your blood vessels to dilate, and the chemical that we're talking about here that increases with either exercises or with that ideal body weight is nitric oxide. We've talked about that before. Nitric oxide dilates the blood vessels. So the more you exercise, the more you tell the blood vessels, I need nitric oxide, the better you get at making it. Mm-hmm. But I've mentioned before that if you have a problem with nitric oxide, one clue for men is erectile dysfunction. And unfortunately, a lot of us do things with our lifestyle that block the production of nitric oxide. We use mouthwash. We scrub the back of our tongue. We take antacids because of heartburn. All those things block nitric oxide. So those are some simple things. There's a pathway of nitric oxide production that requires B vitamins, requires magnesium. So taking a B complex, a high-quality magnesium like magnesium glycinate, can be crucial. But the simple approach of taking medications and supplements is not the effective approach. The effective approach is the hard thing. It's to lose that excess body weight. It's to exercise. It's to eat a plant-based diet, because plant foods, particularly when we chew them up, help us to make nitric oxide. So we're coming back to the things we always talk about, but it really can make a difference. And
explain a little bit more about when we chew them up, because that is important.
Absolutely, because we know that when we chew green leafy vegetables, we're supposed to have 300 grams of green leafy vegetables a day. Most of us probably get less than 150, so we're half the intake we should. When we eat green leafy vegetables, particularly broccoli and kale and watercress and spinach, those foods have a lot of nitrate in them, and the nitrate in our mouth, as we chew it, the bacteria in our mouth convert nitrate to nitrite. When we swallow that, the nitrite is converted to nitric oxide by an acidic stomach. So if you have healthy oral bacteria, you'll be able to make that first conversion to nitrite. If you have an acidic stomach like nature intends you to have, you'll be able to convert it to nitric oxide. But if you're taking antacids, you don't do that effectively.
Right.
If you're using mouthwash, you don't do that effectively.
And if you swallow the watercress whole, you don't chew it up. And then you
exactly
choke.
Right. And there's something to be said about the chewing process versus putting things in a blender and trying to get it down with some fruit in it. It's not quite the same, and that's not what nature intended us to do. We know from some interesting research with mother's milk. I mean, if you want to look at what nature's intended, let's look at mother's milk. Mother's milk is the first 4 days when there's colostrum, it's high in nitrite. Those babies, when they're born, their gut is essentially sterile, especially babies that are born C-section. They don't get inoculated with the bacteria from the perineum of the mother as they come out, so they have a more sterile gut. But all babies don't have a lot of bacteria in their gut for their first 4 days, so they can't make that conversion of nitrate to nitrite in their mouth. So nature said, we're going to provide you mother's milk with nitrite. You swallow it with the acid in the stomach, you're going to make nitric oxide. After 4 days, that milk starts to have nitrate in it, because nature knows that with a healthy diet, it's there. Mm-hmm. So nature's teaching us, if we study it, these are the things that we should do. But most of us don't eat the green leafy vegetables. We don't chew well. We use Listerine, and we take antacids for our heartburn. And all those things, we gain excess weight because we're not eating green leafy vegetables, we're eating fast foods. And all those things contribute over years and years to hypertension, which puts us at risk for stroke, which puts us at risk for heart disease, and puts us at risk for kidney disease. And now we've got all these chronic conditions that we're trying to manage with medication. We're not getting healthier. We're just trying to control them and limit the downstream effect of these conditions.
But supplementing that with the healthy diet is okay.
Absolutely, yes. So a healthy diet, and again, the role of magnesium supplementation, vitamin B supplementation. You can get nitric oxide. Mako's carries a great nitric oxide product, and I've seen it do incredible things. A gentleman with emphysema started using nitric oxide. His breathing improved. A man with erection problems started having normal erections or return of erections. A man with hypertension started to have control of his blood pressure. So these things work, but the key thing that we always want to emphasize is understanding how this works, why it works, and then you've got the information now. You do what you want to with it because it can make a difference.
Right.
So we're trying to empower people, and it makes all the difference when you understand what you can do to control many of these chronic conditions. It's a wonderful feeling to know.
It's always your choice, even if your mother's not there to enforce it on you. But I know yours still will. So
She does. She reminds me. But it's really just it's a beautiful concept that we're not just victims.
right.
And that if we have good information, we can do something about it. That's why I'm so passionate about the message of self-healing. And there's a lot of talk about COVID and how do we prevent the effects of COVID? Can we protect ourselves? I absolutely believe there are things that we can do to protect ourselves from the effects of COVID and to ramp up our immune system. And it's the same kind of things. It's nothing fancy, but people have to understand that you have to get good quality supplements. You have to eat a healthy diet. You have to have positive thoughts. So we've talked about the rabbit effect and how just healthy, loving relationships can be healing. Exercising and getting out in nature and getting sun, all those things. You put that together and you're really putting yourself in line with what nature is intended so that you can heal and your body will work like it's supposed to.
Very good. And fortunately, we have the sun to
We
go
got
out and get
sunshine
into.
today.
So
Take a walk today, right? Get outside, enjoy it.
that would be the best. Hey, thanks a lot.
You're welcome.
Dr. Tim McKnight here. Talk with the Doc, as always, giving us some good information. And it's brought to you by Mako's Pharmacy,